Realized I didn't actually introduce myself earlier. I'm Agustina Gancia. You would have gotten many emails from me. I organized this event with my colleague Shyam, who's from SAMRI. And I'm a senior project officer at HTSA and looking after all of the consumer engagement and our research translation capacity building work that we do at HTSA. So not a small task. Wendy did a fantastic introduction about HTSA and the importance of consumer and community engagement to our work. And I just want to run through, before I delve into the community interest register, which is what I really want to talk about today, about what are the different activities and supports that HTSA does around consumer engagement and does around the community interest register. So Wendy briefly mentioned the HTSA Consumer Engagement Action Group. This group is made up of representatives from our partner organizations, our 11 partner organizations. And these are all champions, local champions for consumer and community engagement in their own organizations. And it's a chance for us to come together to share experiences, challenges, what goes well, what doesn't go well, and learn about how everyone is actually mobilizing in their own organizations, and we help facilitate that. The Community Interest Register, which is a database of consumers and community members who want to be involved in research. I'll actually delve into that as the body of my presentation. We provide one-on-one support to research projects and researchers who want to involve consumers and community members. So we help them recruit individuals onto their projects. We help them think about a strategy. We help them think about their role and what type of involvement they want from the community on their project. We provide training to ensure that all of this happens properly and on evidence, based on evidence, to both researchers and consumers. We produce resources, so we have a toolkit on our website that I invite you all to go visit, where we have templates, information sheets, and guidelines. We hold an annual event, which you are all at right now, and we also involve consumers and community members in HTSA-led projects, so evidence-based best practice projects. The Community Interest Register. So that is our database of consumers and community members who are interested in being involved in research and health and medical research. People who join the register can have an experience of a specific health condition, could be a consumer of health services, either themselves or caring for someone who's had an experience with a health condition, or just have a general interest in health and medical research. When people join the register, they're offered a training. So we hold 2 induction sessions per year to ensure that everyone is on the same standing. So what's consumer engagement? What are the different roles that you can have in a research project? What type of engagement exists out there? And also, what is research? So what are the different stages of a research project? What's a grant application? What's an ethics committee? So we look at all of that in the basic training. And the register is available to all HTSA partner organizations. So as Wendy mentioned, we have 11 partner organizations, and researchers who seek support from us, who come from these organizations, have access to that database. They don't have access to the data, we manage it, but we connect them. We connect people together. So I welcome you all to visit our website for more information. Now, the Community Interest Register was actually a collaboration, launched by SAMRI, the South Australian Health and Medical Research Institute, and we collaborated together to launch this endeavor in 2019. It was governed by the Community Interest Register Working Group, which existed between 2017 and 2021, and it was linked to the original SAMRI Consumer Advisory Group. So this was a group of consumers and researchers who guided the strategy of consumer engagement for the Research Institute before even HTSA existed. At the moment, people who join the register join it through word of mouth. So we're not doing any active promotion of the register to the community per se. But historically, we were promoting the register through social media, newsletters, and the SAMRI public tours. So this building used to have weekly public tours to the community to visit, to learn about what happens within the walls of this building. So we decided to change that strategic direction to promote the use of the register by researchers, because we were finding we were getting more and more and more people on the register, but the researchers weren't actually seeking to involve consumers and community members. So that's why we changed the strategic direction to actually really go around knocking on doors saying, hi, this exists, you should actually be involving consumers and community members. And we've seen a real increase in the number of expressions of interest and engagement requests that the researchers put to us since we've actually done that change in direction. The reason we're here today is that over the few years that the register has existed is that we've seen the numbers grow. We currently have 140 active registrations. And when we look at the demographics, we find that it's pretty homogeneous. 42% of the people on the database are over 55 years of age. And there's very few people in proportion, few people who are under the age of 44. We see it's predominantly populated by females, with just under a quarter males, and very few people who identify as non-binary or prefer not to identify themselves. And out of the 14 areas of interest that we list on the registration form, the main ones are around aging, cancer, dementia, resilience, nutrition, and mental health. And we have very little other information on the registration sheet. So it's brought us to think about what kind of information do we want to have? What kind of demographics do we want to have on the register? And if we're telling researchers to increase diversity and to diversify the methods of engagement with the community, is this the right channel? Or is this, are we doing enough to diversify the database? In the last reporting period between August and November, we've received 13 calls for expressions of interest from researchers. So we've had 13 people or groups come to us and ask for support to promote things via the register or to recruit individuals via the register. Of these 13 requests, 9 were local, so we were able to track down that data. The 2 states and the 2 national events, we don't know because the registrations go to them. But for the 9 local requests that we've had from researchers, we've asked them, how many people actually contacted you? How many people did you actually recruit on your project? And on average, they say about 4 per project. And we had some discussions with them, and we established that, in general, for some people, that's few responses. If you're looking to build a focus group with 6 to 8 people, sometimes they wouldn't get enough people from the register. Often it's the same people who raise their hand as well. And we established that we need new ways of engaging. And we need, to diversify who's on the database and diversify who researchers go to recruit on their projects. We thought that not everyone is going to want to sign up to a register. So is this actually the best way, or the best way to recruit for a project? And whether we should just be going to the different communities that researchers would want to recruit from and making involvement easier that way. We also discussed maybe having a database of stakeholders, which we have, HTSA, given it's a statewide group. We have lots of partners, lots of stakeholders beyond the 11 partner organizations. So what if we have a list of organizations that represent different communities, and then researchers can be linked to those? So that's where it leaves us today. That's why we're talking about diversity today. We want to really hear from the community, researchers who have experiences engaging with diverse communities, to see how have they gone about it, and how have they reached out, and how have they collaborated with different communities. So